Hi, my name is Maria Quinn. I'm a psychiatric nurse practitioner here at Holyoke Medical Center, and I oversee our recovery support. And today I'm going to be talking about medications for the treatment of substance use disorders as one pathway to recovery. While there are multiple kinds of substance use disorders, currently there's only approved treatment for alcohol and opioid use disorder, and that's what I'll be talking about today. When talking about a substance use disorder as a diagnosis, I think it's really helpful to know that there are 11 criteria that we use to decide if somebody fits into the category of having a substance use disorder or not. The first one is tolerance, which is defined really as requiring more of a substance to get the intended effect. The second one is withdrawal, which really refers to someone who has been taking a substance, and then if you take it away, you have undesirable, usually physical symptoms from it. The inability to cut down or stop. You spend more time obtaining, using, or recovering from the substance. You take more of the substance for a longer of time than intended. You are unable to meet your responsibilities at work or home. You have relationship issues. You give up doing things that you once enjoyed related to work or social. Physical or psychological issues related to the substance. Using despite danger or physical hazard, and then cravings. It's important to note that two of these criteria, tolerance and withdrawal, they don't count if you are currently being prescribed a medication and are under the care of a medical provider. So if you're being prescribed pain medications currently by a doctor and they're monitoring your care, you don't fit the criteria for a substance use disorder. So when looking at this, we say, if you have 2 to 3 of these symptoms, it's categorized as a mild substance use disorder, 4 to 5, moderate, and then 6 or more, you would have a severe substance use disorder. This criteria fits really for any substance use disorder, so not just alcohol and opioids, but also cannabis, benzodiazepines, etc. And when thinking about substance use disorders, we know that there are multiple impacts on our health, such as these listed here. We know that it affects your liver and several other organs, such as your heart. It impacts your immune system. You have neurological complications. It increases your chance for infections and cancers, and many, many other things, including death. The CDC has estimated that on average, 95,000 people die each year from excessive alcohol use. So when I think about 95,000 people, it's a hard number to kind of grasp. But looking at this slide, this is the Rose Bowl Stadium in California, and it has a capacity of a little bit over 95,000 people. So within the stadium fits the number of people that died last year from excessive alcohol use. And then last year, between October of 2019 and September of 2020, over 64,000 people died from overdose related to any type of opioid. And this is the stadium where the Detroit Lions play, and they fit about 65,000 people there. So looking at this is about the same number of people that died last year from an opioid overdose. And overdose and death is really something that we're working to prevent, and working towards recovery. And recovery is defined as a process of change through which people improve their health and wellness. They live self-directed lives and strive to reach their full potential. It's a completely individualized process. When thinking about recovery, it's important to know that there's multiple pathways to recovery. You have mutual aid support groups such as AA and NA. You have peer recovery supports. You have medications, which we'll be talking about in a minute. We have residential treatment facilities and several other. So why medications? Why would somebody take medications as their pathway to recovery? Well, medications have really been shown to improve patient survival. It increases the time that somebody stays in treatment. It decreases the amount that somebody drinks or uses other substances. It decreases any type of illegal activities related to substance use. It improves your ability to get and maintain a job, and it also improves birth outcomes for pregnant women who have substance use disorders. So medications for alcohol use disorder. Currently, there are only 3 medications that are approved for treating alcohol use disorders. So the first one is Naltrexone, and Naltrexone is a medication that really works by decreasing the pleasurable effects and cravings for alcohol. You don't have to have abstinence to start the medication, meaning you don't have to have stopped drinking alcohol completely before starting it. And I have found that this is actually really helpful for individuals who are not yet at a point where they want to stop drinking completely, but they recognize that the amount that they're drinking is a problem and they want to work to cut down. This medication is usually dosed once a day. It's also an opiate receptor blocker, so it's not really helpful for individuals who have chronic pain and require opiate pain medication, or individuals who also have opiate use disorder. So while this medication is available to be taken once a day, it's also available as a monthly injectable as well, known as Vivitrol. The second medication is acamprosate or Campral. This medication is recommended to have abstinence before you start, so you have to have not been drinking before you start this medication. It requires 3 times a day dosing, so it's a little bit harder in terms of commitment. It's beneficial, though, for individuals who do have co-occurring opioid use disorder and alcohol use disorder, or if somebody requires opioid pain medications and also has an alcohol use disorder. And the final one is Disulfurium, also known as Antabuse. So this one works as a deterrent to alcohol use, meaning you experience significant unpleasurable symptoms if you take in any alcohol when using this medication. You can't have any alcohol for at least 24 hours prior to starting, and it is once a day dosing. So now looking at medications for opioid use disorder. Again, there are only 3 medications that are approved currently to treat opioid use disorder. And the first one is Methadone. Methadone is medication that is usually dosed once a day, but in some cases is dosed twice a day. It works by reducing cravings, and it treats physical symptoms of withdrawal. It's a medication you take daily, so maintenance treatment. It's only available at an opioid treatment facility and is very highly federally regulated. Second medication is Buprenorphine, and it has several trade names, one of them being Suboxone. Dosing varies on this medication, so it can go from 1 time a day up to 3 times a day. It works, again, by reducing cravings, and it also treats physical symptoms of withdrawal. It's medication that's used for maintenance treatment, meaning you take it every day to maintain sobriety. As I said before, it reduces cravings, and you have to have a specific training and a waiver to prescribe this medication. And it comes in multiple formulations. So on the slide here, you can see there is a film. It also comes in a pill or a long-acting injectable or an implant. The final medication is Naltrexone. It's a medication that's available as an injectable for opioid use disorder. It's medication usually start after you've had medically supervised withdrawal, or in some cases we use it for relapse prevention. So if somebody has been in recovery for some time and is thinking about or concerned that they may start to use opioids again, it's a medication that's great to start. So length of treatment. Oftentimes I get the question of how long do I have to take this medication? Does my wife have to be on this forever? And really everybody is different, but all of the studies have really shown that positive outcomes are dependent on adequate length of treatment. So how long somebody is engaged and retained in treatment, meaning not only taking the medication, but engaged in other things that support their recovery. So while I completely recognize that somebody says, I don't want to take something every day, I also say, let's focus on the right now. And then we continue to alter the treatment plan as you decide when you don't want to take it anymore. When thinking about addiction, as it is a chronic illness, we really see that there's a big discrepancy in terms of how people see that somebody should require ongoing treatment. So when you think about somebody, on the left, it's looking at somebody that has hypertension, right? So before they started treatment, before they started changing their diet or taking a medication, the severity of their symptoms was high. So their blood pressure was high. They weren't feeling well. They had headaches. Then they started treatment, changing their diet, taking medications, and their symptoms went way down. And then again, you can see that they go up if they're no longer in the treatment. It's the same thing for substance use disorders and addiction. So when somebody has a chronic illness, including addiction, and they have a recurrence of symptoms, you adjust the treatment plan. And adjusting the treatment plan doesn't always mean increasing medications or going to another treatment facility. It can mean just increasing supports, talking about what's going on. So who's accessing treatment? Who's actually coming in and being treated? The reality is that not enough. This slide is really showing from 2015 to 2018, individuals who are identified as needing substance use disorder treatment, less than 15% of them were actually accessing treatment. So why are people not accessing treatment? There's multiple barriers, things like insurance, accessibility, things like that. But then there's also things like stigma. Stigma not only to substance use disorders in general, but also stigma related to the treatment type. And when somebody feels stigmatized, it really leads to things like isolation. People start to deny that they have an illness. It increases the risk of somebody overdosing or having a recurrence of symptoms. And it also leads to lack of prenatal care. So people don't want to go in and be cared for when they're pregnant because the stigma that's attached to that. Recovery capital is another barrier to accessing treatment, which I'll talk about in a moment. And then also readiness for change. Sometimes individuals are just not ready to change their substance use and be abstinent. And that's why it's important to talk about harm reduction, because harm reduction is not about minimizing the risk and dangers of substance use. Harm reduction is actually about minimizing and reducing the harmful effects of substance use. And it's also about really meeting people where they're at and recognizing that abstinence is not for everybody. There's no universal treatment or recovery plan. It's completely individualized. Part of recovery is, looking at what internal or external resources you have that you can draw upon to initiate or sustain recovery. And that's really the concept of recovery capital. And recovery capital is broken down into three main areas. So personal recovery capital, family and social recovery capital, and then community recovery capital. And when you're looking at personal recovery capital, it's something like, your purpose. Do you have a place to live, a safe place to live? What's your health like? Do you have health insurance? What is your educational level? What are your values? What's your self-esteem? And then you think about family and social, and it's, do you have close relationships? Do you have people in your circle that support your recovery, the process of recovery? And then finally, community recovery capital is looking at really policy and law around substance use disorders and addiction treatment. Is there access to treatment? Do you see that communities are really working towards decreasing stigma associated with addiction and treatment? Do you have access to recovery centers? And when talking about this, it's really about the whole picture, right? So medications, like I was talking about earlier, is one piece. But if you don't have a place to live, if you don't have people that are supporting you, it's really difficult to work towards recovery without having these things. So how are we addressing recovery here at Holyoke Medical Center? We've really been working hard over the last several years to address recovery, starting with the emergency department, where we recognize that this is where individuals come in the most acute state. So after an overdose, or maybe after a motor vehicle accident related to alcohol use. We have recovery coaches and a strong social work team who's accessible to the emergency department and really meeting with people and providing connection and resources. We have the recovery support team that's made up of recovery coaches, certified addictions nurse, myself, a recovery support coordinator, working with patients both in the emergency department and all the medical floors to assess where somebody is at and offer treatment, including medications or referrals to other levels of care. The Comprehensive Care Center is our outpatient office where we treat individuals with opioid and alcohol use disorder using medications that I mentioned earlier, with the exception of methadone. We don't do that here. And then we have several behavioral health supports here. We have the partial hospitalization program. We have River Valley, our partner agency, and several other agencies in the community that we partner with. So I think in closing, I just wanted to highlight that medications for alcohol and opioid use disorder are evidence-based approaches to treatment, meaning there are studies that have shown that they work. They work and they save lives. There's multiple pathways to recovery aside from medications, and hope is really the foundation of recovery.